Hi, this is Dr. Gary Sykes, and this vlog is on the popular question, will I need to have an epidural? The large majority of epidurals are administered because a woman requests to have an epidural. It's not because the obstetrician suggests it or the midwife suggests it. No, it's a woman requests it herself. She's not coping with the pains of labour and she requests an epidural block be administered. There are some women who will make this request before the onset of labour, in other words during the pregnancy. They do not want to experience any pain at all in labour. So the implication of that is that this woman is induced. So she comes in, the epidural is administered, her labour started, her labour ends, and she has not experienced any pain whatsoever. That's becoming an increasingly popular request. Now there are some situations where an obstetrician will recommend an epidural. For instance, if it becomes apparent that the lady is not making good progress in labour because she's quite anxious, because she's in so much pain, an epidural can help immensely. I've seen it so many times where an epidural is administered, she relaxes, and there's excellent progress. Sometimes there needs to be syntocin augmentation of labour, or there's an induction and there's a syntocin infusion, and the midwife is reluctant to increase the rate and so optimise the contractions because they're worried about causing the woman have more pain. But without optimising the rate of the syntocin infusion, there will be lack of progress in labour. So an epidural is a good idea in that context. Sometimes if there needs to be an operative vaginal delivery, or there's retained placenta, then an epidural, but more likely be a spinal anaesthetic is administered to facilitate this. But those situations I find are very few and far between. So it goes back to, no, you don't need to have an epidural, but certainly if you want an epidural is there for you. The only time that's not so if a woman makes that request and she's in second stage labour, not coping with the pains of second stage and delivery is imminent. That's a pointless exercise, sadly, because by the time the epidural is administered and effective, she'll have delivered her baby. I hope that information helps and I look forward to speaking to you again soon. Bye for now.